having established that it is unintentional or assumed it is unintentional, now we need to achieve the significance. Weight loss of around 4 to 4.5 kilogram or more than 5 to 10% of the original body weight can be called significant in a clinical sense, especially if this has happened over the previous 6 to 12 months. If the weight loss is still progressive at the point of consultation, that is more significant than the weight loss which has been happening in the previous 12 months but has been static in the immediate 6 months. For example, over the past 6 months, if the weight has been stable, then that is less alarming than somebody who is currently actively losing weight. Once a person loses more than 10% of their original body weight, then there is impaired immunity in keeping with the protein energy malnutrition, and weight loss of more than 20% is severe, and you expect pronounced organ dysfunction, and this has got clinical implications. The more important take home point from this slide is it is absolute quantity as well as the speed of weight loss that is of concern. For example, if somebody has lost 5 kilogram over 12 months compared to another person who has lost 5 kilogram over the 3 months, the later patient is of more concern than the previous one. So significant weight loss has got implications. It is a predictor of morbidity. It delays wound healing. It makes one prone for infectious complications, pressure sores, and WHO performance status. It interferes with the response to medical therapy and dosing of medications, and weight loss is a marker of mortality as well. So when you approach a patient with weight loss, you raise the following issues in your own mind. The foremost question is, does this patient have an underlying malignancy or other serious illness? What are the immediate implications? For example, if somebody is awaiting procedure, then what is the morbidity associated? Do we need to address that issue before the patient undergoes the treatment? What is the best way to evaluate both tailored to the patient's need as well as taking the economical implications into consideration? And more importantly, how this patient should be treated concurrent to the evaluation process, because sometimes you need to treat and evaluate in the same time frame than in compartment. The foremost point is history. How much weight loss over how much time, the quantity and speed. Previous weight fluctuations and trends are important because some people may be losing weight and gaining weight and stabilizing over a period of time, and that could be the repeated episodes throughout their adult life, and that should be taken into consideration. And as I said, patients downplay weight changes, and we should objectively assess how much weight loss has happened over the specific time. So sometimes in the absence of records, we need to go by indirect evidence, whether they need to change the wardrobe, make new holes in their belt, and also secondary information from observers like friends and family may be of help. So here I show you 4 types of weight loss. The first patient has fluctuant weight loss over a period of several years. The second patient has a stable weight for so long, and then there is some weight gain, and then it drops again to their previous baseline value. These 2 groups of patients are of not much concern, and we can try to understand and observe, but there is no need for jumping into investigating them. The other group is a slow and steady decline, and this could be due to a chronic illness like chronic pulmonary disease or chronic heart or kidney disease. Here we can attribute to the underlying chronic medical illness and then provide additional nutritional support to offset this gradual weight loss. Whereas the last group of patients who have been holding their weight steady for so long, and with a recent drop in weight loss, again the quantity and the speed are keywords, and these patients will ring alarm bells